Thank you, MPP Smith, and thank you, Minister, and invited guests for joining us today. I'm Duff Sprague. I'm the CEO of the Peterborough Family Health Team. It's no secret that family medicine and primary care are in crisis. It is felt very deeply here in Peterborough. I want to commend our family physicians and our clinical and administrative staff for the dedication they showed throughout the pandemic and continue to show today. The Peterborough Ontario Health Team partners look to address this crisis and put together a Barriers to Primary Care working group, which I had the honor to chair. Agencies from mental health, addictions, nurse practitioner clinic, the city, the hospital, a family physician, and our family health team were tasked to bring back to the OHT Steering Committee a recommendation to address this crisis. In very short order, we put our individual organizational needs aside and agreed that a community health centre for Peterborough was the #1 priority. The Peterborough OHT funded us to develop a comprehensive proposal, which we submitted to the ministry with the very active support of our MPP, Dave Smith. Our combined efforts make me hopeful that today is going to be a very good day for Peterborough. I now have the pleasure of introducing the Honourable Dr. Jane Philpott. Dr. Philpott is currently the Dean of the Faculty of Health Sciences and Director of the School of Medicine at Queen's University. Dr. Philpott is also the CEO of the Southeastern Ontario Academic Medical Association. Dr. Philpott?
Thank you very much. Good day. Today is a good day for the people of Ontario and for our health systems. As Duff said, I am Jane Philpott. I'm the Dean of Health Sciences and the Director of the School of Medicine at Queen's University, and I am thrilled to be here to celebrate the impact that this funding is going to have for the people of the City of Kingston and the surrounding region. We know that currently about 30,000 people living in the Kingston area do not have a primary care provider. But with today's announcement, that is about to change for the better. Queen's University has been one of several partners in a primary care initiative that includes the Kingston Community Health Centre, the Frontenac, Lennox and Addington Ontario Health Team, the City of Kingston, all of our local hospitals, and SEMO, the Southeastern Ontario Academic Medical Organization. On behalf of all of those groups and the people of our region, I want to thank the province for this investment. It's going to improve the health and well-being of the residents in our communities. And with this funding, we're going to be implementing a health home model of care. We call ours the Periwinkle model. It is one that will provide access to interdisciplinary primary care for about 10,000 people who currently have no family doctor nor any other primary care provider. And we dream that someday we can scale and reproduce our model until every single person in our region has a primary care home, the first place that they will visit for all of their health needs, served by a team that provides accessible, longitudinal, comprehensive, coordinated, whole-person care. The health home model offers sustainability for our health systems by means of an interprofessional, team-based primary care. And so if you need to see a doctor, you'll see a doctor. Or if you need to see a nurse or a nurse practitioner, that's who you'll see. If you need the care of another health practitioner, like a physiotherapist or an occupational therapist, a dietitian or a social worker, you will receive the right care from the right provider at the right time. And in addition to providing much needed health services for our patients, the health home is also going to be a place to grow the health workforce, a place where future health professionals in medicine and nursing and rehabilitation therapy programs will train alongside colleagues from multiple disciplines. We know that regions built with strong systems of primary care will offer the best health outcomes at the most affordable public cost in a way that is both equitable and accessible. Today's news moves us all one big step closer to the dream of ensuring that every person in Ontario will have a primary care home. Thank you.
Good morning, everyone. My name is Dr. Andrew Park, and I'm the president of the Ontario Medical Association, and we represent all 43,000 doctors across the province. I'm joined by our CEO, Kimberly Moran, and also proud to be joined by the President of the Ontario College of Family Physicians, Dr. Mehele Kuminen. Minister Jones, on behalf of Ontario's doctors, thank you for the invitation to join you here today. The OMA is committed to working with you to create sustainable improvements to our healthcare system. Ontario is facing a family doctor shortage in every part of the province. Publicly funded research shows that 2.3 million people do not have a family doctor, and that number is expected to double in 2 years. Family doctors are the foundation of our system. When patients are connected to a family physician, their health outcomes improve. These outcomes include longer life expectancy, fewer hospitalizations, and improved quality of life. This is why every Ontarian should have access to a family doctor and a healthcare team supporting them when and where they need it. We've been calling for investments in teams to improve access to care and to ensure doctors and healthcare professionals are able to do what they do best, to take care of their patients. Today's news is a big step in that direction, and for that, we thank you. Supporting team-based care led by physicians will be helpful for both healthcare professionals and their patients, and will play a key role in building healthy communities. Patients attached to a team can receive care for the most appropriate and skilled provider in a coordinated and integrated fashion. Access to care is improved, leading to decreased emergency department visits, hospitalizations, and overall system costs. The strains on the healthcare system have ballooned over decades, and it will take time to fix these issues, but we must start somewhere, and we must start now. Doctors want to care for their patients, and they want to be supported in doing so. Investments such as this send a signal to physicians, healthcare workers, and patients that the government is listening and that help is on its way. Listening to Ontario's doctors today will lead our system out of crisis tomorrow. Thank you, Minister, for your shared vision of better health for all Ontarians. Minister?
Thank you very much. Well, good morning, everyone. It is indeed a great pleasure to join you here in Peterborough today alongside a fierce, underline fierce, advocate for his community, Dave Smith. I want to thank Dr. James Philpott, the Ontario College of Physicians, the OMA, the Ontario Medical Association, the Ontario Hospital Association, the Registered Nurses Association of Ontario, and the Alliance for Healthier Communities for joining us today, and of course, many municipal leaders. And a thank you to Duff and your entire team here at Peterborough Family Health, for all the healthcare workers across Peterborough, for everything you do to connect patients and families to exceptional care every single day. Under the leadership of Premier Ford, our government has been making record investments in healthcare. We also know when it comes to your health, the status quo is not working. For over a decade, the NDP propped up the Liberals as they cut medical residency positions, cut the number of physicians practicing in family health teams, and created the longest healthcare wait times in Ontario's history. As a result, too many Ontarians are still having to wait too long for appointments and necessary surgeries, having to travel too far to access care, or spending too much time navigating the healthcare system. That is why, 1 year ago, our government introduced Your Health, a comprehensive plan to make bold, innovative, and creative changes to strengthen all aspects of the healthcare system, making it easier and more convenient for Ontarians to connect to care closer to where they live. And we are starting to see the results. Ontario does have the shortest surgical wait times in all of Canada. Almost 18,000 people getting their cataract surgeries at community surgical centres between April and December of last year. And the backlog for surgical cancer screening was eliminated last August. We are continuing to make progress in improving mental health care, opening 8 new youth wellness hubs over the past year, with 22 hubs launched since 2020 that are connecting more than 43,000 youth and families to mental health services, primary care, and more. We are getting shovels in the ground for over 50 hospital developments that will add over 3,000 new hospital beds to the already 3,500 we have built since 2020, building more beds in 4 years than the Liberals added in 14. While the NDP sat idly as the Liberals fired 16,000 nurses, we've added more than 80,000 nurses in Ontario since 2018. In fact, 2023 was another record year, with more than 17,000 nurses registering to work in Ontario, and another 30,000 nurses studying in Ontario colleges and universities today. We've also added more than 10,000 new doctors since 2018. And we're listening to our frontline doctors, our family doctors, about the challenges they face. Many are overworked. Some are burnt out. And that is why we are working closely with the OMA to eliminate duplicate and outdated forms, so doctors can focus more time on patients and less time on unnecessary paperwork. We're allowing pharmacists to treat and prescribe medications for 19 common medical ailments. And this program has been a huge success. Last year, pharmacists completed nearly 700,000 assessments at over 4,500 pharmacies across Ontario. That's hundreds of thousands of fewer visits to a doctor's office, relieving pressure on family doctors and our entire healthcare system. We currently lead the country with 90% of people connected to a regular healthcare provider. And we've added hundreds of medical residency positions, specifically for family doctors across the province. But while we're pleased with this progress, we know there is more to do to close the gap for the people in Ontario not currently connected to a primary care provider. That's why today we're announcing an investment of over $110 million to connect over 300,000 people to primary care teams in their community. This will add over 400 new primary care providers as part of a 78 new and expanded interprofessional primary care teams in Ontario. These teams, consisting of family doctors, nurse practitioners, registered and practical nurses, and more clinicians, will help people currently without a family doctor connect to primary care. Here in Peterborough, this new funding will allow the newly established Peterborough Community Health Centre to connect more than 11,000 people to primary care. Today's announcement also includes the innovative proposal in Kingston, where an investment of $4 million will help over 10,000 people connect to team-based primary care. I want to recognize and thank Dr. Jane Philpott for her work in this project and for her advocacy to ensure we are growing our healthcare workforce for generations to come. We are not going to stop until everyone that wants to have a primary care provider can connect to one. Together, with historic investments to expand medical school spots and breaking down barriers so highly skilled, internationally trained doctors can care for people in Ontario, Ministry of Health modeling shows that these initiatives will help connect up to 98% of people in Ontario to primary care in the next several years. We've made a lot of steady progress over the past year, but we know there is still more to do. While the NDP and Liberals are opposed to innovation, our government will continue to work hand in hand with our healthcare partners to take bold actions to provide Ontarians with the right care in the right place. We will get this done together. Thank you, and stay well.
We'll now begin to take questions from the media. As a friendly reminder, the format is one question, one follow-up. Please state your name and your outlet before your question. If reporters present could kindly form a line behind me, we'll move to the first question.
Good morning, Minister. Kenyon Wallace with the Toronto Star. We heard yesterday that in Alberta, the provincial government there plans to ban pediatric transgender surgeries for anyone under 17 and hormone treatment for anyone under 15. Can you tell us if Ontario plans to follow these type of measures?
We're not making any changes as it relates to gender-affirming surgeries in the province of Ontario. Look, we are very focused on expanding access to service, expanding access to primary care in the province of Ontario, and that's what we will be focusing on. Thank you.
As my follow-up, you may have heard that in Sault Ste. Marie, the closure and retirement of local health clinics there have left 10,000 people without primary care physicians. I'm wondering if your announcement today will have any impact for those people. Will it help them?
You know, what is happening in Sault Ste. Marie is deeply disturbing, clearly. The number of people who will be impacted by those changes is something that, frankly, this announcement just reinforces how important it is. And yes, there are 2 proposals that the community in Sault Ste. Marie brought forward that will be funded through this program.
Next question.
Good news is good news.
Let's all fight for it. It's way too high. My name's Joelle. I work for the Peterborough Examiner. You mentioned this will be funding for a new community health center. How much funding is it for Peterborough? It's part of a larger funding announcement. I'm just wondering how much for Peterborough.
Yes, so Duff, I'm going to turn this over to you because the application actually came through the Peterborough Family Health Team Community Center, but the entire provincial investment will ensure that the Periwinkle project in Kingston and the Peterborough project here will be funded through the $110 million.
Thank you, Minister. The proposal that went forward was for $8.6 million, and no one expects that to be able to start up and open the doors the next day. So there will be a transition, looking for space, bringing on physicians and nurse practitioners, but it will be a very staged approach. That's really the only way it can be done. But again, the proposal was for $8.6 million.
All right, how soon do you want to open?
Very soon. People need it. I know a board is already formed. A small board, they're going to build up and get larger, and I think they're already poised to take action. So actually, Jonathan might leave the room right now and get that started. So.
All right, thanks.
We'll move to our next question. And I believe this will be the last question as well. Thank you.
Yeah, it's Robert Lothian with Global News Peterborough. Can you just give us a sense, a bit of where some of these doctors will be coming from? It's my understanding that it was the AMO earlier this week that had said that Peterborough alone needs about 40 new family doctors, and that's part of a much larger issue.
So I'm going to start with some of the investments and changes that we have already put in place. So we've talked about a ministerial letter that I sent to the College of Physicians and Surgeons of Ontario and the College of Nurses of Ontario to make sure that they quickly assess, review, and ultimately, when appropriate, license internationally educated physicians, nurses who are waiting for that Ontario license. That has led to a historic increase in the number of internationally trained nurses in the province of Ontario that were able to get their license last year. So we'll continue to work with those colleges to make sure we do that. And I'm in active, ongoing conversations with the federal government to say, when internationally trained physicians want to come to Canada and want to practice in Ontario, let's make sure that the barriers are removed. So again, working with the College of Physicians and Surgeons of Ontario, we now have been able to remove a practice-ready assessment piece for 4 countries, individuals who come from 4 different countries, and we hope that in the coming months and years, we'll be able to expand that to make sure that the barriers that have been historically in the province of Ontario and in Canada are removed appropriately. Of course, referencing in my remarks the fact that every single medical school in the province of Ontario has had their residency spots increased by a minimum of 20 and the larger 50. I will highlight the work that Queen's University under Dr. Philpott's leadership has now a partnership between Lakeridge Health and Queen's University, where students who wish to practice family medicine actually have the ability to work directly in community, and this is one of these innovations that we really want to embrace and make sure we do more of. The increases in residency spots that have been put in place, 60% of those are actually held for training family physicians. So we're doing things in the short, medium, and the long term to make sure that in decades to come, we will have an Ontario population that is well served with their primary care services. I can go on, as you can tell. Another piece that is really important is scope of practice changes that we've been able to implement, working again with the College of Nurses of Ontario, with the RNAO, to make sure that nurse practitioners, pharmacists, RNs have additional skills that they can be using and their patients can benefit from. And those scope of practice conversations are an important part of making sure that these interdisciplinary teams are truly working as a team. Thank you.
That concludes our media availability. Thank you everyone for coming. If I could get all the speakers to stay up there for a group photo, that would be great. Thank you.